One of the favorite topics that a lot of people want to know is what triggers heart attacks. I think that's something that we always want to try to stay away from. Everybody wants to know what that is, but it's really a pretty broad topic. But I know that you kind of like reel it in, can't you?
I'll do my best.
Okay.
So I think an important idea to be thinking about if you are concerned yourself about having a heart attack someday is to go back to a lot of the concepts that we've mentioned before in addressing the root cause of a problem. So a lot of times we see patients who come in and they've been previously prescribed something like a blood pressure medication. So they're now taking a blood pressure medication because at some point in time their blood pressure has been elevated. Instead of asking the question, why has that blood pressure been elevated, they've decided to approach it from I'm going to start chasing my tail point of view. And using that analogy, you can imagine it's probably not the most efficient way to go about it. If there's a reason why your blood pressure has been elevated and you don't address it, you're piling a problem on top of another problem. And when that continues to compound, oftentimes it can overwhelm the heart's ability to do what it does. And the end result of overwhelm is shut down. And that's typically what a heart attack looks like. So we can talk about the inflammatory process within our hearts. We can talk about the dynamic changes that happen normally, but can be a part of an underlying problem. All of those things on top of themselves, on top of each other, just create a really tough situation in the production of heart attacks and other problems.
Yeah, I think one of the things that we focus on a little bit too much in the medical world is the genetic aspect of heart attacks. When every time I go into a physician's office as a patient, they always want me to fill out the form, do you have any genetic ties toward heart disease? And if you never had anybody in your family that ever had a heart disease problem, we think that we're safe because we're kind of told that genetics is everything. Genetics is the reason why we're victims of our world, that we don't really have too much input as to whether it's going to happen or not. You're just bound to have a heart attack. If Grandpa had a heart attack and Dad had a heart attack. And if they didn't, then we don't look for it. I think that if you put it upon yourself to understand that everybody who has a heart has the potential of having a heart attack if they don't deal with the heart in a good way and respect the heart. And the heart, in a sense, is such a vital organ. It's looking at not doing the things that are detrimental. We kind of are selfish in our own regard because we want our cake and to eat it too, and we want to do what we want to do, and we don't want to have negative things caused by it. So we live our life and then we go to a doctor to take and say, fix it for me, but we don't change what that is. And the causes would be eating bad, drinking too much, smoking, not exercising, not getting away, having too much stress. When you do have stress, instead of dealing with the root cause of the stress, we medicate the stress. We don't drink enough water. We talk over and over about how the body has a design. It's a unique design that you can't change. I don't care how bad you want to live your life and you think that you can get away with it, but if you have an orange tree and it needs fertilizer and water and you want to put turpentine on it because it's fun and you want to do it, it's going to cost you. You're going to pay a dear price. Cardiovascular disease, the cause of that is always the bad lifestyle things and not being able to handle the world. I'm 63. I remember when the cell phone was started, my son brought it in to me and I was doing something else. And he says, there's somebody that wants to talk to you. And I knew the world was then following me. and I couldn't get away from it. Now I have a cell phone that's on all the time. I'm bombarded with the world, the news, information. Some of that elicits an emotion in me. If I don't do well with my emotion triggers a physiological response, which makes my heart rate go up. I start sweating. My heart is trying to survive a stressful moment. Unresolved conflict in a person's life will trigger a heart attack. You have to be able to get to a place where you resolve those things. Don't take life so seriously, and make sure that you take and don't let the world control you, because in today's world, instead of letting the world do it and then medicating to try to support ourselves in a world that's dysfunctional, we have to take and live more of a normal, relaxed, even deep breathing. If you don't take a deep breath every once in a while, we use probably 25% of our lung when we breathe. When's the last time that you ever took a deep cleansing breath? What that does is it automatically reduces your blood pressure, it oxygenates your blood, and your heart rate immediately starts to reduce. So we are so much in control of our overall heart health, and I could say reverse heart disease immensely by living a good, clean lifestyle and addressing those factors instead of taking just the medications. Change your lifestyle. Don't live in a lifestyle that needs to be medicated. Change your lifestyle so you can take and functionally support yourself without the medications. My dad is 89. He takes no medications. He golfs 3 days a week, and he rides his bike and swims. He does not have any heart disease. My mother's 86. She just tiled the house last year. Neither one of them take any medications. Well, how do they do that? They proactively take care of every single function of their body, and their heart is probably the most important thing. And I promised them both that they would not end up drooling in a bed with a diaper on at the end of their life. That's proactive life, and heart disease is very, very reversible with that type of an attitude of lifestyle.
Yeah, I'll say one more thing, and I think it's a really, really important point that was hit on. I don't think we give ourselves enough credit. I think too often we run for help when we're in circumstances where we are starting to develop disease because we feel like we need that help from outside sources. But for the most part, I think the biggest blessing of being in practice the way that we are today is that we can't take credit for the benefit that happens within the bodies of our patients. I'm not the one that heals my patients.
No.
It's ultimately the approach that those individuals take that help improve what is already programmed to happen inside of their bodies. It's just making those decisions and making it straightforward and as easy as possible for them to do those things. That really helps to prevent and reverse these types of issues. It's an honor and it's a blessing, and it's one that we have the honor of seeing on a daily basis happen.
That's right.